Mr. DeLeon, could you just tell us exactly what the project is about?
Thanks again, Bill. Yes, the Virtual Education Library was introduced in order to give the children of Jamaica and also here in the U.S. an opportunity to learn in a different platform. We believe by creating a new education demand platform will allow the children to learn in a new environment and will also stimulate them in a way that they have not been stimulated so far. We've already met with the Minister of Education now, and who has also approved the first phase of our project and is getting ready to now be presented with the phase 2, which is the technical portion, which we hopefully will be able to give within the next 6 months. So until then, let's hope and keep our hands together, because we will be delivering this new platform for the 21st century very soon. This partnership started roughly 3.5 years ago, with basically starting with a computer donation program that has now evolved into creating educational libraries with computer labs. And the last phase that we're now getting ready to implement is the networking of these computers and allowing these computers now to have access to a new virtual private network where the children will gain access to educational software by age and by grade.
Today we have Dr. Mason. He is the president for the Institute of Panamanian Affairs, and he'll give you a brief synopsis of how important it is to have the hospital in Jamaica.
Yeah. Well, first of all, I'd like to congratulate Winston Wellington for this initiative in terms of building and working to get a hospital erect for the people of Jamaica and the region where he is. Public health is certainly an issue to be addressed not only in Jamaica, but we are grappling with it right here in the United States in terms of trying to make healthcare accessible and available to all. And as you know, the Obama administration is trying to push through some healthcare reform legislation that will change the landscape as to how we see that here. Speaking of Jamaica and countries in the Caribbean that are developing, public health is certainly a critical issue, that especially for women and children, and especially for the island of Jamaica. And the type of efforts and the type of guidance under the leadership of Wellington, Mr. Wellington, certainly that will be meeting some key needs in terms of Jamaica, not only in terms of families and children and women, but also when we look at elderly, and we should not ignore the health of males also. And that is particularly important when we take a look at the situation in terms of public health around the globe. And we see a situation like HIV/AIDS that is devastating the Caribbean region. The Caribbean region now is second to Africa in terms of the AIDS epidemic. And besides the AIDS epidemic, we also see that we have some needs in terms of maternal child health in Jamaica. And we also need to enhance and improve the public health system, as well as the health care delivery system, and certainly a new hospital in the region where Mr. Wellington is will certainly be of benefit to the people of that region, and therefore to the people of Jamaica. So we want to congratulate him on his efforts, and we wish him well, and we call on all to support this wonderful initiative. I thank you.